Most people are well aware of the brain-gut connection issues in autism. We have a lot of kids struggling with gas, constipation, stomach pain, nausea, diarrhea. We've also seen a correlation between higher anxiety levels in constipation in autistic kids and actually higher levels of very specific bad bacteria related to constipation. They tend not to have a varied or a biodiverse gut biome. Proper digestion and elimination is really, really crucial. It's not just the ability to absorb nutrients, expel toxins, but the making of many important brain neurotransmitters also happens in the gut, not just the brain. The brain really is the hungriest organ in the body. It wants to devour up to 40% of your daily energy and nutrients. So it's crucial that everything is working well. An interesting side note in autism research that when these kids took the daily essential nutrients, they found that the gut biodiversity actually increased. Pretty cool. But beyond dietary considerations, as parents, we have a significant role in helping our children's gut to work better, offer some relief. And one approach is through massage. So in the upcoming section, I'll show a simple abdominal massage designed for children with digestive issues. These techniques not only promote peristalsis, like aiding in smoother bowel movements, they also stimulate the lymphatic system for cleansing, activate the parasympathetic nervous system. That's your nervous system associated with rest and digest. And if any anxiety is interlinked with your child's digestive struggles, this massage can really give some relief. So let's go to the next section. Hi, today we're going to do an abdominal massage for a child that struggles with constipation. And not only that, this is important for the gut biome, to move the lymphatic system so they have good elimination. We know that in the gut, we produce more serotonin here than we do in the brain. So this is a really, really important area. So today I have my son Joseph, who's going to be helping me. And the first thing you want to think about with massaging your child is do it when the child is calm, not when they're overwhelmed, not after a big meal. Make sure the room is nice and warm. I have a nice warm blanket on him to make him feel kind of comfortable. And the next thing you want to do is you want to get permission. So Joseph, do I have permission to massage your tummy today?
Mm-hmm.
Excellent. That's really important, is you want to teach the child that they have rights over their body, especially when you have autism or ADHD. A lot of times they feel out of control, that they don't have control over their body. So we're going to pull back the blanket. We're going to pull up his sweater, and we just want to expose from about the ribs to just below the belly button. Now we're going to do a quick little anatomy lesson to know what we're touching. And first I'm just resting my hands firmly on Joseph because he's a little ticklish. Does that feel okay, Joseph? Okay, you just want to take your time. Don't just jam in and rush into the abdomen. So right about here, and you want to actually stand, this is easy if you stand on the right side of your child, because we want to go in a clockwise direction on the abdomen. So it'll be best, more comfortable, you're on the right side. And right about here on the left, and right around here, up here is about the stomach area. You can feel the edge of the ribs. And this is where food comes down after being worked on in the stomach. It's going to come down to sort of generally this area here around the belly button area. This is the small intestines. This is where most of the food is, actually all the food should be getting absorbed, all the nutrients absorbed into the body. So if you have a child with celiac, irritable bowel, Crohn's disease, they're having issues with assimilation of nutrients. If you do have a child who has Crohn's or irritable bowel, don't massage the abdomen when they are inflamed, spasming, or irritated. So this area is the small intestines. And then over here, going up the right side here, this will be the, he's getting ticklish. is the ascending colon. Then across here on the edge of the bottom of the ribs is the transverse colon. Then down here is a descending colon area. And then right around here in front of the hip is where it's going to move down into the sigmoid colon and where you poop everything out. So the first thing you want to do is you want to think about with constipation is as the food moves this way to the colon and to here is the body is trying to reabsorb water. So the more everything moves to this area, the firmer and drier it's going to be. So if we have constipation, we probably have some things stuck in here. So it's kind of like opening the cork on a bottle. You want to start on the descending colon area or the left side down here first. And so what you can do is let's start with some stroking. This is going to also work with the lymphatic system. The lymphatic system is all around the small intestines as well. It's there to help pick up fatty acid, fats, and also works with your immune system to make sure no bad guys are getting through from your food. So we're going to start with stroking. Does that feel okay, Joseph? And really it's firm but very, very light. You do not have to go very, very deep on the abdomen. The reason why you want to stick light is down the middle here we have an aorta, we have a major blood vessel. So we don't want to do deep, deep work ever on the abdomen. Light is just sufficient. So after I do some stroking, and you can use a bit of oil if you want. I'm not using any oil, but if you're nervous and your hands are sticky, a little bit of oil is fine. Castor oil is really, really good with the constipation. Castor oil stimulates the bowels moving. Be aware because you are also absorbing it in your hands. You will probably hit the toilets just as much as your kid will. He finds that funny. Okay, after we've been stroking, we're going to do just little circles with our hand. We're going to start lower down, and then we're going to work our way up. I'm right on the edge here of the ribs here, and you can see my hand is always pushing towards the sigmoid colon area. That way we're going clockwise, and we're going to go this way. Remember, always gentle, firm but gentle, and you just take your time. We're going to go backwards. We're going backwards on the ascending colon. And then very gently over the belly button area, clockwise, right here. Now, one thing to be aware of is as I do this, below the belly button, I'm not going to actually work there or put any pressure because the bladder's there. We don't want to put pressure on the bladder. Now, after I've done that, I might also do some clockwise, hand over hand, over the whole belly. Now, if you have a child that is having issues lying still on the table, they could have a tablet or a phone. They could be watching a movie. They could be playing a game. They could play with a toy. That's totally fine. I'm pretty lucky that Joseph's old enough now, and he's fine with sitting still. So the key thing with working the abdomen is really it's repetition. Just hand over hand. You can do one hand. If you're getting tired, you can do one hand. Just going over the whole belly. When I go below the belly button, it's very light because the bladder's down there. So I put a little more pressure up top, lighter on the bottom. A little more up top, light on the bottom. You could also ring, where you go back and forth, and you ring like this. Back and forth. So feel free to do this as long as it's comfortable for the child, as long as the child can sit still, what you can handle. It's very, very common that as you work the abdomen, especially if they've been constipated, you're moving gas. So the child may feel like they need to expel some gas, and that is actually a good sign, is you're moving the gas out of there. You're stimulating peristalsis. The other thing that you're doing as well is you're putting them in a parasympathetic nervous system state. This is the opposite of fight or flight, and this is a good thing. If you hear their tummy growl, that's an excellent sign. It doesn't mean they're hungry. The growling means that the parasympathetic system has turned on and they're in a state of relaxation and good digestion. And this is what we want. All of this helps the brain. There we go. Joseph, how are you feeling? You feel good, relaxed? Excellent. So I'm going to pull this down now. And that is a very simple abdominal massage that you can do as a parent. Thank you.